Well, good morning, everyone, and welcome to our weekly live question and answer session, where we join you with a physician of integrative medicine here at Tustin Longevity Center, and we answer your questions, any and all health related. My name is Talon Ellithorpe, and I am the practice manager here, and I'm joined by Dr. Rita Ellithorpe, our medical director and founder. What you want to do is ask us any questions that you have about health. You can do that in the chat section, which should be off to this side of the screen. And if you post your questions there, we're monitoring them. I'll ask the doctor your questions. And while we wait for your questions, Dr. Ellithorpe, why don't you fill us in with thoughts or anything you're seeing in the news or research-wise? What's been on your mind?
Well, I guess number one, I always want to preempt this saying this isn't to be medical treatment. This is generalized as advice, because it's usually hard to be able to get a live time where you can ask an integrative doctor any question. And so that's why we're doing this largely for our patients, but we're happy to try and answer any integrative question. Again, this is not meant to be personal medical advice. But what I want to point out is the validation that what integrative medicine stands for is preventative medicine. We're integrating our standard medical school training along with what we didn't get in medical school, which is all the nutritional, the physiology, the ancient ways and medicines, diets, physical exercise, lifestyle medicine, anti-aging medicine. And when you integrate those, then we call ourselves integrative doctors. And we have the ability to balance both these areas of expertise. And hopefully this will be an interesting series of questions that we have.
I hope so, and we look forward to your questions. We're keeping an eye on that. In the meantime, Doctor, we had a question emailed in from Robert, and his question had to do about EDTA chelation, and he asked, he was reading a study that says that calcium disodium EDTA can cause redistribution of lead from bone to soft tissues, including the brain. The article recommended that EDTA should be followed by DMSA. Is there any reason to worry about lead being redistributed to the brain with EDTA? And the study that he mentioned was Chelation, Harnessing and Enhancing Heavy Metal Detoxification, a review by Margaret E. Sears.
Well, I'm not familiar with her article, so I would have to read it myself to look at it. But I've been around and involved in EDTA chelation therapies for about 50 years. In these 50 years, I have never seen any ill effect of calcium disodium EDTA chelation or EDTA chelation, just the standard disodium EDTA chelation. Rather, I've seen health prolonged, life prolonged, cardiovascular disease diminished, diabetic, cardiovascular, peripheral vascular disease diminished, enhanced visual clarity, mental clarity, so only benefits. But let me give you my gut feeling on this, and that is there is a body of people since the TAC2 trial came out in 2012. That was the trial to assess chelation therapy. It was an NIH study by the government. Our tax dollars paid about $35 million to run this over 10 years. We had 1,708 individuals. They all had a heart attack. And with that heart attack, then they saw their cardiologist. They got the standard of care any cardiologist would do. But on this trial, some of them were given a good multivitamin, antioxidant, and chelation therapy, and some were just given the chelation therapy and not the multivitamin but a placebo. Some were given a chelation alone and not the multivitamin, and then some got neither the chelation nor the multivitamin. So it was actually spread into 4 groups. And what we found is that those who got the EDTA chelation and the multivitamin antioxidant did superiorly. We're talking in the realm of what drugs cannot achieve. There is no drug that can achieve the prevention of subsequent problems to people who have heart attacks. Then in the group that had just chelation but not the vitamin as well, they also did superiorly compared to the standard of care. Then the group that got just the vitamin alone did better than standard of care. And then finally, standard of care had the same degree of incidence of the following subsequent second heart attack or rehospitalization or stroke or various problems you have after you've had one heart attack. That study was so remarkable, they did a second study called TAC Trial 2. That TAC Trial 2 is focusing on the damages of the American diet, of a high-carb diet, because there were so many diabetics in the study and so many who are diabetics who get heart disease earlier. They focused on them because the most dramatic improvement was in the person who had diabetes. We're talking somewhere in the realm of, 50% reduction of all-cause of incidence after a heart attack. That's unheard of. And I don't have the number in my head, but it's in the 50s. So when all this good news came out, yet a third study came out, and that third study is now dealing with just the peripheral vascular, the toe that is gangrene and so forth that recovers. This created a bunch of excitement in the scientific community, and in that community then there are those who are critical of EDTA chelation, or there are those who don't have as much experience and they're learning, yes, there is DMSA, which is primarily a mercury chelator, but I am a conservative doctor, integrative doctor, and if EDTA chelation has been used for 70 years, hundreds of millions of doses worldwide over 70 years, and if it takes out mercury and if it takes out lead, as well as gadolinium and other things, and I have no side effects, I'm going to stick with that rather than work with DMSA. Okay? Now, I'm not saying you can't work with DMSA, but I'm saying I get the good results as well. And I believe I have
some reports.
Yeah, I have some reports here. Now, all of us, men and women especially, by the time we're 40 years old, you start aging clearly and you demineralize your bones. So whether you chelate or not, osteopenia, you'll start dissolving your bones. And guess where that lead is? That lead is in your bones. So you're auto-intoxicating yourself just by being alive.
It's happening anyways.
It's happening anyway. Now, whether or not that, I was always taught, and I have never seen any brain accumulation of lead. I have never seen that as a serious concern. But all the more reason everyone needs chelation therapy for longevity. And I have a patient, one of my patients who just came to me last week on January 18th of this century, 2020. She did her challenge, which was just calcium disodium EDTA. And we do give a 250 tablet of DMSA. And she had, just to give you a visual picture of what this test looks like, she had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 heavy metals. And you can see the mercury was 280, and you can see the lead was 13, and the arsenic was 520.
It's a lot of elevated heavy metals.
Yeah, it was huge. Now, she just repeated it April 21st after her 30, and look at the diminishment. Her mercury dropped to...
significantly. We had a lot of numbers in the red and yellow that are now in the green.
Right, so she was 280 in the mercury, and now she's 110. She was 520 in arsenic, and now she's 22, and so forth. So you can see dramatic improvement. And yes, EDTA chelation, because that's all I use is calcium disodium EDTA. So, ladies, she has much better symptoms. She's feeling better. She's thinking better. All her systems are improved. And I would just suggest to you that everyone needs EDTA chelation. As well, I think all people who are in intensive care units for whatever cause, to improve microcirculation, whatever the disease, if it's an infection or a sepsis or a brain injury, enhancing the tiny, tiny capillaries, microcirculation will advance the medicine delivery and the removal of the debris and injured cells. So EDTA chelation should be a part, along with high-dose vitamin C, for all seriously ICU admitted patients.
Thanks, Doctor. I think you definitely answered that question thoroughly. I've got a couple more questions that just came in. Another one from Robert asking, besides fasting, do you think taking exogenous ketones are beneficial?
I think the answer on that is still out. I have read articles about the benefit of taking exogenous. There are packets of oral ketones that you can take to raise up your ketones to make you feel satiated and not hungry. But then I've read articles that it does not make as much difference. I'm not going to put myself out as the expert in a clinical practice. I'm going to say that we need to learn to eat less carbs. And one of the reasons we need to learn that is because these people who, for instance, were in the ICUs were largely people who had secondary illnesses, the obese, the underlying conditions like diabetes or heart disease. And diabetics get heart disease, okay? That's well understood. And so prevention is the goal of health care, and it should be. It isn't what is currently done in the standard of care. And I had an article over the weekend I was reading. This article was published on May 13th, 2020, and it was put out by what organization? The Journal of Diabetes. And in it said, diabetes in residential clinical practice, May 13th, 2020. Glycosylated hemoglobin is associated with systemic inflammation, hypercoagulability, and prognosis of COVID-19 patients. Basically, they said a high hemoglobin A1C level is associated with inflammation, hypercoagulability, low oxygen saturation in the COVID-19 patients, and the mortality rate, 27.7%, is higher in patients with diabetes. So ladies and gentlemen, all my patients at the clinic, I know of none of my patients that had the COVID-19, or if they did, they had no symptoms, and we'll never know. And I don't necessarily want to do a test on them and find out either. But prevention is the key here, ladies and gentlemen. And they're going to tell you that it's acceptable to have a hemoglobin A1C from 5.7 to 6.4. And I'm going to say that's way too high. That's what I call pre-diabetes. And they're going to say it's normal to be normal is below 5.7. I have all my patients aim for 5.2 or less. I don't want you to get diabetes. I don't want you to get obese. I don't want you to have Alzheimer's. I don't want you to have poor response to infections, because a lower, healthier blood sugar will help your immune system be much more robust.
Absolutely. And to that point, normal means average. And do you want the average health status of the American citizen? I don't think so.
No.
No, not at all.
I don't. And they just do a statistical average, 1 standard deviation, 2 standard deviations, 3 standard deviations. And this is not health. This is just surveys. Health is when we see people eating less total calories, intermittent fasting a day, a week. These are the people who have the better control of their blood sugars, those who don't eat late at night. So if this whole viral issue has brought anything to forefront, it's that we doctors who have stood for getting your vitamin D in you, getting vitamin C into you, or having vitamin C drips available, getting EDTA chelation out to the public so you can enhance your oxygenation and microcirculation, getting zinc into your bodies. And then I had another study published. You've heard of the doctors in New York City. Joseph Rahimian. This was New York University Grossman School of Medicine, Department of Medicine, published this online under the title of Hydroxychloroquine and Azithromycin plus zinc versus hydroxychloroquine and azithromycin alone, outcomes in hospitalized COVID-19 patients. And the crux of the matter is in their a lengthy paper. They said the main finding of this study is that after adjusting for the timing of zinc therapy, we found that the addition of zinc to hydroxychloroquine and azithromycin was found to associate with a decrease in mortality or transition to hospice among patients who did not require IC level of care. What that means is those zinc worked. But zinc works preventatively. Zinc did not work as well once they're so sick, so on the edge that they had to go on ventilation in the ICU. That's too late to ask zinc to do preventative care for you. We as integrative doctors get that, and we get all our patients on a healthy multivitamin, mineral, zinc-rich and selenium-rich, plus other things, so that all our patients do well. So prevention, again, the diabetes study, the New York study, they're all saying, ladies and gentlemen, we got to cut the carbs and start doing preventative medicine.
Thank you, doctor. And just to pause there, I want to say I hope that these live weekly Q&As have been beneficial. They're meant to be an interactive event. We want to interact with you and answer your questions, and we want to serve you with the information that you'd like to hear on. So how can you support us? Well, if you're finding this content valuable, please like the videos, subscribe to our channel, and share it with your friends and family. That kind of gives us some feedback that we're making traction with you guys, and we'll continue to invest in this and continue to do this weekly. If you have suggestions, or if you'd like to see a different format, or perhaps just us get up here and speak on a particular issue, you can comment on that even after this is live in the comment section below the video. Mm-hmm. So please, we do monitor that. We check in on that even after the videos have posted. But thanks for liking and subscribing to the channel. Doctor, the next question is from Sir Wim. The sun does not send us vitamin D, but the body uses UV rays to help our bodies make it. Do we need vitamin D supplements? Pretty easy question.
Yeah, there are UVA, UVB, UVC wavelengths. And they hit our skin and take cholesterol and help convert that into a form that is then transformed in our kidneys into cholecalciferol vitamin D3. So what I find is that my patients are just low in vitamin D.
Because we test every one of them.
Yeah, we test everyone, all 5 doctors of us here. And so we have to ask, why is the lifeguard out in the beach here at Newport Beach with low vitamin D? And years and years and years ago, maybe 20 years ago, I saw that. Well, you know, there's clouds and chemtrails, and they have aluminum oxide, barium oxide dust, and that deflects the radiation from the sun. And I think that's their weather management for climate change. They're trying to reduce heating of the planet. So we believe that the amount of UV radiation that would normally have hit you has been greatly diminished by all of this chemtrailing, because that's the only explanation I can explain for the fact that even young, healthy people are very low as a general rule. So yes, I would check my level once a year, and I would do it roughly around October of every year to make sure during the flu season you have enough vitamin D. And what's enough? I like you to be around 80 nanograms per deciliter.
And a standard typical dose that almost all of us are on is 5,000 IUs of vitamin D at least a day. Some people are as high as 10,000 a day.
Yeah, and I always marry it 99% of the time with vitamin K2, because that helps with your bones and so many other immune enhancing and appropriate calcium deposit into the bones, not your soft tissue.
Okay. With about 10 minutes left, we have a few other questions that came in. Deborah asks, what can be done to stop or help alleviate arthritis in joints of the fingers? I utilize many TLC supplements, Juice Plus, as well as low sugar diet. Maybe just old age? I'm 68 years old.
Number one, we would ask you to make sure you're drinking half your weight in ounces of water every day. That's number one. Number two, EDTA chelation will help with the microcirculation to your joints, okay? Remember, joint spaces, I did a lecture on that on the YouTube on the joints, and the synovium of the joints with each other, there's no blood supply in there, okay? All of that is depending on a tiny, tiny little membrane the synovial membrane that gets capillaries to it. And as we age, they get clogged with too many sugars, food, antibody, complexes and such. So chelation does help. Number three is curcumin, turmeric. We have Turriva, Turvia. That's
Turriva. From orthomolecular, right?
How do you spell it?
Turriva, Turriva.
Turriva.
It's the whole plant Turriva extract.
And that has been well studied as a generalized anti-inflammatory. Number 4 would be systemic enzymes. So on an empty stomach in the morning, I would take 5, 8, 10 Vitalzyme or 5, 8, 10 Vascuzyme or 5, 8, 10 Proteozyme, a bunch, okay? I would probably fast for 24 hours just on water, a 1-day water fast, and see if you don't suddenly improve with the water, not eating, the increased enzymes, and maybe some Turriva, turmeric. I have TLC Deflame as well, which is a turmeric one, but that's not the whole root.
And hopefully chelation.
And I think you'll see a benefit.
Next question from 6 million. Do you really need plants to get all your nutrients, or just a carnivorous diet with organs can achieve all the nutrients?
Yes, and we know this from research. Research shows that like the Eskimos get no plants, okay? And they ate the blubber and stuff, and they did quite well, and their teeth were excellent. Now, they don't get the fiber in general, but I would say that the organ meat is the sole number one. An egg, for instance, has all the nutrients in there to grow an entire chicken, okay, or bird. So the egg and the yolk is such a beautiful composite of nutrition, minerals, fats, and vitamins. So yes, I would say this is very, very valuable.
Now, could you obviously survive on just plant-based nutrition, animal-based nutrition, but we really like some of the phytonutrients that are found in the fruits and vegetables without the sugar.
Right. I try and get my patients to have organic, wild, fresh, pasture-raised, farmed poultry, meat, fish, and you could have crustaceans if you want. So I try and get them to have a protein with a low-carb vegetable for their 2 meals a day. I don't recommend 3 meals or snacking all along. And that way they get the plant kingdom in what kind of vegetables? Broccoli, Brussels sprouts, asparagus, green beans, spinach, cabbage, as opposed to all these high starchy ones. Now, if I was addressing 1920, 100 years ago, the people living in America, they were all thin. There was no obesity problem. I wouldn't worry so much about them having a yam or a potato or some quinoa. But today, since we have an epidemic of diabetes and obesity, that's why I'm so strict on the low-carb vegetables. But yeah, I like a protein and a vegetable for lunch and dinner, and never eat late.
A question from the same user. Also, what is your opinion on Weston A. Price Foundation and its dietary advice?
Yes, I like Weston A. Price. In fact, Weston is the one who went in the early 1900s when there was a new invention called a camera. And he got the camera and he went all over the world looking at primitive people to see their dental health. And he found a correlation between vitamin K2. He called it the unknown vitamin, or vitamin X. And we found later on this is vitamin K2 that are in the dark leafy green vegetables. It's in the first spring clover that animals eat, and then you eat the clover, and then a cow makes this rich first cream in the spring that's given to young couples for their fertility. It helps enhance the sperm motility and fertility. So Weston Price is a fine man. I like his book. I like their cookbook. I like the whole organization. I would check it out. In fact, one of the videos I've been using 20 years here roughly is by Sally Fallon, who runs Weston Price Clinic, and she had that video called The Oiling of America.
Right.
Yeah, so that's Weston Price. Yes, I like him very much.
Okay, last question so far. Can pregnant women go on a water fast for a day?
for a day, I'm sure it's safe and fine, and I'll tell you why. Because throughout all history, women have not had the food they need. There have been, sieges of cities, and the people couldn't eat, and so forth. A one-day water fast is not harmful. I don't know that I would do it over and over and over and over again, but certainly I think it's safe to have a one-day water fast.
And that's something you probably want to talk to your doctor specifically
individually about why do you want to do it. If I had a pregnant woman who was having acute diarrhea from something she ate,
right,
I would ask her not to eat, and I would just have her take water, beef broth, and chicken broth.
Okay, great. Actually, that is our last question. We're getting a couple comments, people saying thank you, and they love your passion for helping. So thanks so much for that. And again, if you're finding this valuable, please like the video, please subscribe to the channel, and let us know your thoughts in the comments section. Doctor, anything else you want to say before we sign off?
Oh, I always have lots to say.
Well, let me check the time here, because I know you have a patient coming up. We have about 3 minutes left.
I would just say that some of the other things, and I have a stack of files back in the office, but mutations, May 5th, 2020, this publication was physiology.org. And this was published May 5th, 2020, and it's called Mutations in SARS-CoV-2 Offer Insights into Virus Evolution. What they're pointing out here is that the virus is mutating, and the ability to make a vaccine is very hard predictably. And the flu season, it's very hard for them to keep up with the mutations. And the other thing they said about this was the SARS-CoV-2 genomes offer an excellent geographical and temporal coverage of the COVID-19 pandemic. Specifically, more recent sample strains have accumulated additional mutations in their genome that older ones, since their divergence from the most recent common ancestor. And what they're pointing out is that it's changing all the time. And there are parts, on this article, you can see they're tracking all this flow dynamic and sampling of it. So there are now whole genealogies of this SARS-CoV-2, and they can tell that it's novel, that it's new, but they're having a hard time trying to figure out what part of the virus are they going to try and attack with a vaccine. So a second article came out from Science Direct, and this is called The Emergence of Genomic Diversity and Recurrent Mutations in SARS-CoV-2. That's the one I just read. The other one is Mutations in SARS-CoV-2 Offer Insight into Virus Evolution. It's changing, folks, and it's hard to find an area there that is stable enough to predictively design a vaccine. So I am concerned about development of vaccines and their ability, and I know there are some humans that were studied as guinea pigs. They're doing this so fast, they're jumping over animal studies, and we're getting hints. Now, this is not official. We're getting hints that these 45 people who were very healthy were seeing reports that there are side effects. And so I'm watching this very closely. So I just want to let you know I have my finger on the pulse, and I'm watching this, and this is very difficult. I suggest we prevent being affected by the virus by building up our immune system.
By doing all the things we've been talking about.
And do it all.
Well, with that, I just want to say thank you for joining us. We appreciate your input, and we hope this is beneficial and interactive. We look forward to seeing you again next Wednesday at our scheduled time, 9:45 a.m. Pacific. And we do this for about a half an hour every single week. And just feel free to leave your comments below. We'll be looking towards that, and looking forward to see you all next week. Thank you so much. Thank you, Dr. Ellithorpe.
Thank you.
All right, you all take care.